Well, baby, you've been on my mind. I think about you all the time. Oh, I want to see your face. That don't make me wait.
I don't even know how to start this because I'm so excited. Everybody, this is Sleeping Around the Podcast with Dr. Ann and Matthew. And this is a first.
Well, this is my better half. So it's only right that I do bring him and showcase him to the world, because I would not be where I am today without the support of him. Eric has been always very supportive of everything I've done, even when I say I want to do crazy things like flying to Texas to do podcasts. I asked him, obviously, like, would you like to be one of our guests? And he goes, I don't know what I'm going to talk about. So I said, you have such a breadth and depth of experience. You have to come on because you have so many things that I think are going to be relatable.
I got to ask this question. When she said she was going to join in with us, talk us about how that went at home. Because y'all have two little kids at home. Mm-hmm. You're one busy woman.
Yes.
So initially, I thought it was a good idea. Obviously, always looking to protect her. Want to know what someone else's angle is, if someone's trying to bring her in, and what's going to be the gain for her versus a loss for the family as well, because time away is difficult. So we agreed after speaking about it for a while that this would probably benefit everyone. That even the opportunity to travel with the kids once the podcast is up and running, and make a family trip. So we came out and agreed that it was a good idea. You guys have a great connection, and the podcast seems to be going really well.
We're around the same age. You look way younger. Talk me kind of through a little bit, as comfortable as you want, kind of how you met Ann.
Well, I think Ann and I are both on the same page of how we tell the story. I think it's comical. I mean, it's great. We met in a traditional fashion, a nightclub in New York City called Greenhouse.
I love this.
I was done dating at that point. I was going out in New York City and meeting people every night and having...
You were?
Yes. And
he said people.
Yes, exactly. And women, and going out on first dates that were absurdly expensive in Manhattan. And I might as well just go hand $500 to a complete stranger, because I'm never going to see them again either. Because, I mean, it's just, these dates were just...
That's called prostitution.
No, but
I think,
like, not even have dinner, not even have anything. Just give it to a random stranger on the corner. Because it was just such a waste of time, and really hard to connect or find someone that you can connect to. So I was going out. I had my crew of friends, and we were going out sometimes 5-6 nights a week.
Jeez.
And coming home at like sunrise.
Yeah. Now you know why I said the crazy sleep history.
So, you know,
Can I ask how the age range you were in?
This was 13 years ago.
Okay.
So
Yeah.
late 30s. Yeah.
That's
So
about right, yeah.
Yeah. So I was going strong, and I was always last man standing. Like, I was always able to stay out. Never was into drug use. Alcohol was fine for me, but I could always stay out. So, you know,
He's your classic evening type.
Yeah.
Classic, like, I can stay out all night long. Yes,
without a doubt.
And that's our opposite.
Early morning person.
I'm the morning lark, and he's the night owl.
Certainly, yeah. So, you know, I'm at a point where I'm like, okay, I'll talk to people when we're out. I'm just out to have a good time with my friends.
Sure.
And was talking to another woman at this club. It was my friend's birthday, and in comes Ann and her sister. Her sister was interested in my friend Manny. And Ann and I just started talking, and Ann was like, you need to get away from that other woman. So, you know, Ann saved me there. So
more ways
I was staking my claims early on.
Yeah, it's a nightclub in Manhattan, so I could hear every other word.
Yeah, I was going to say.
Yeah, but she seemed nice. She
looks nice. You're like,
yeah, exactly.
Yeah.
Well, she was dressed super casual that night, so like
Ann?
super. Oh yeah. She was wearing a Jelly Belly tie as a belt on a dress. Like she had just done.
So it was New York Fashion Week at the time. So again, remembering, I have a very traditional background. I was in med school. No, I just finished med school. I was a first-year resident in New York. And at the same time that I was a first-year resident in New York, I was also working part-time for a vodka company, doing their sales and marketing in New York. And so New York Fashion Week, we had a big event at Dylan's Candy Bar. And so Jelly Belly was there. There were all these Jelly Belly executives. One of them gave me their tie. And so I was like, I'm at this event. I have to wear it as a belt. Well, then we got to the nightclub, and I forgot the belt in the car. So then I'm at the nightclub in a dress with a Jelly Belly. Yeah, it was a unique fashion statement.
Yeah, certainly. So, you know, the evening goes on and it ends, and we do have a couple of pictures from that night, actually.
Yes.
So we do have pictures of the first night we met.
Yes, with the Jelly Belly tie.
Yeah, absolutely. Yeah.
Is there any way we could get those to Dan to put up?
Oh yeah, I think they're on
I'm sure we
Facebook.
could.
That
Yeah.
would be a good. That would be a great shot.
Yeah.
So the next day, of course, I did not call her. I was not
The
interested
next
in
day or the following day.
You
or
did
the
the
following day.
stupid guy rule.
No, it wasn't even like I was making her wait. I just wasn't going to call because I was done with being let down.
Gotcha.
And my dog I just adopted a dog. She was really sick. And at that point, she was like my priority, she was my baby.
Right.
So Anne had gone and with her sister to my friend's diner, Manny, right? His family owned a diner in Jersey. So
Not cliche at all, but
no, Greek.
Right.
Yeah, exactly. Diner, Greek family, yes.
But awesome food.
Yeah, absolutely.
not cliche at all.
No,
Yeah, without
awesome
doubt.
food. Yeah.
So, Manny calls me and he's like, did you ever call that girl that you met when we were out? Because she'd be perfect for you. And I said, no, I didn't. He's like, she's everything you're looking for.
Oh,
Because he knew I was a relationship person.
Yeah.
I was just done with being like burnt and being dragged through the single scene. So I said, all right, let me,
that I know what that's like at all. Being used for my body and my looks.
So it was 3 days later,
long hair.
and I texted her, and I'm not a person to like just text to text.
Right.
So I texted her just to see if she would respond. And then when she did respond, I'm like, can I call you? So that won points
Great
with
move.
her because she was already really mad at me apparently and had written me off.
I
And
was like, I don't do this 2-day rule.
yeah. So then we were speaking on the phone for a little bit, and it turned out that she lived 5 minutes away from me on the same road. I lived in Edgewater, New Jersey, and she lived in North Bergen.
Yeah.
But it was the same road, and it was a few minutes apart. And I said, did you eat anything yet? And her answer was, I'm resident.
I
eat
had a yogurt.
Yeah. So
True.
we went to a BYOB, really cool place called Archetypus.
Yes.
And we
if you're
did
in
not
Edgewater,
bring any
New
liquor.
Jersey, you have to check
Edgewater
it
is
out.
very
Yeah.
cool.
But
phenomenal.
Archetypus is super cool. It's like you're eating in a cave.
Yeah.
Great food. It was amazing.
Yeah, phenomenal. So we were there for about 4 hours, no alcohol, just eating and talking about everything that you shouldn't talk about on a first date.
Right.
And from that point,
Life mate, that's someone who is your companion, and it's never perfect. I don't care what anybody says, but that you find that person. I mean, y'all knew right away.
Yeah.
Yeah. Yeah.
And obviously you had been through the ringer in relationships and stuff, and we're just kind of, but I think it's also at that time where we go, I'm done.
Yeah.
I'm not looking anymore.
Yeah.
That it happens. And
Yeah.
so-
Well, and I think it's important for people not to give up on love, right? So for Eric, this isn't his first marriage. And so a lot of people get scared about having to get remarried because they've been burned or hurt, and that I think contributed a lot in terms of why he was like, this isn't worth it, right? Because you never know what you're gonna get. People put on their audition person, right? When you first start dating them, and then the real person arrives when they become secure, right? So you get the audition, everything looks glitz and glam and awesome, and they tell you all the things you want to hear. And then after you go past the audition and you move in together and you're being more regular, now all of a sudden you're like, who's this alter ego? And I think that one of the things that Eric and I have benefited from over the years is really being able to identify areas where we're just completely aligned, but in areas where maybe we have a little bit of a difference of opinion, we're always able to come to that compromise. And so I think that those are things that if you're listening and you've been in that situation where you felt like Eric and you're like, I'm giving up on love, or like you said, my picker is broken, it is sometimes just being able to identify where are those character traits that you want.
But what I wouldn't do is compromise. And it sounds like that's what you did. I got to a certain point, and call it what you will, you said something that I hope our audience heard. Your authentic self is so important. And I read this amazing book, and it talked about that whenever you show your authentic self to someone, it's how they accept you. But we always have these masks on and these walls up. And so I'd meet these amazing women, and they would be just awesome. And then it would get to that next level, and that authentic self would come out.
Sure.
And not all their fault. I would see their authentic self, and I would run from it, because then it would remind me of something in my past, or remind me instead of facing it. So
Sure.
I'm not blaming anyone I've been in a relationship with. I'm not blaming you. I'm just saying that it wasn't a good fit.
Sure.
They're a good person. I'm a good person. Just, you're not my person.
Yeah.
Yeah.
Well, it's hard to find someone with similar values and morals as well. That's a huge challenge. And we've been trained to not discuss certain things early on in relationships. And I feel like those are the most important things.
100%.
Because you need to know right off the bat. I mean, I've had friends who have completely different sets of values who get married, someone that's completely different than them. And it's an uphill battle the whole way if
Sure.
it lasts.
Right.
And I didn't want to run into a situation where, I wanted to have kids and I want them raised with someone who thinks like me.
Right.
Even though we have completely different backgrounds, like Ann went the college professional medical school route. I tried college for a short time, didn't like it, wasn't for me. I'm a worker, blue collar, but, I've had 3 different businesses. So for me, we're completely different, but we're the same.
Yeah.
Right.
So core values is what.
I'm curious, being married to someone who is so passionate about sleep, it could either be annoying or
Well, can we rewind a little bit?
yes, sir.
To when we met, when she would be probably 4 hours, 5 hours into work,
Yeah.
and she would be texting me and I wouldn't answer.
Right.
And she would finally get a hold of me at like noon. And she's like, "Where have you been?" I'm like, "I've been sleeping."
Yeah.
Because I was still on that whole
Right.
like nightmare of like trying to catch up with sleep and going out and staying up late. So even when we were living together,
Right.
I was staying up till 3, 4 in the morning.
Yeah.
And then, business was kind of running itself at that point. So I was working remotely since 2009. So for me, I didn't have to be anywhere. So that was a challenge. So over the years, many, many years, it took for me to get a normal sleep schedule. But Ann was not a sleep doc or interested in sleep initially. That came
She's
later on. Yeah. So, but now, it's definitely a big part of our lives.
My thing is her passion about sleep, because it's got you live with her.
Yeah.
I mean, I met you a little over a year ago, and I've very rarely met someone like you that it's all about sleep. So walk me through that a little bit, because you said she wasn't always a sleep physician. Now that transformation.
I would say that it was a combination of things, because even though I wasn't a sleep doctor yet at that time, and how you're describing people can be on different sleep schedules, it is problematic in a relationship, right? So I'm a morning person, he's a night owl. By the time he's ready to go out and do things, I'm like, dude, I'm done. And I can remember in the time when I was a resident, he would always joke like, "Do you have a sleep disorder?" to me, because I was working 27-hour shifts. We'd be out to dinner. We'd be out to dinner. Exactly. Because I was so sleep deprived as a resident. I would be able to just be out. And then it's like once that certain time hit, and then that's how I think he started actually changing his schedule some, because in order for us to have full time together, he needed to be waking up earlier. And so it still is this dance, because I'm a person who my ideal schedule is I'm in bed by 9 and I'm up between 4:45 and 5:30. That's my ideal schedule. However, that means we just put the kids to sleep and we might have 10 minutes together. So there's those days where we have to compromise on me staying up later so we can go and like watch a show together or do something. But I do think that it was over the course of my residency in child neurology that he started shifting his schedule. And then it wasn't towards the end when I decided I was going to do a sleep medicine fellowship, and then became just completely invested in that.
Yeah. I use the word obsessed, but invested's fine. Invested's fine.
I had a history of sleep issues even prior, though. As a teenager, I fell asleep in class constantly.
Let's talk about this.
I remember back then no one thought of sleep disorders.
No.
It was never really resolved. I mean, it was at a point where they're like, maybe you're depressed kind of thing. Let's bring you to a counselor. But I was the one who I would fall asleep in school every day, probably multiple classes. And I remember having a teacher who didn't even care. He was the teacher who was on his way out and everyone loved him because he didn't care.
Absolutely.
But he would just show, he'd bring the projector in back then. And
Dan, a projector is sorry.
And we knew that meant, heads down. You could go to sleep, which that was, and it was like oceanography class or something. It was like bizarre class. But that was through school. And then when I was probably 18 to 22, I used to fall asleep, like have to fall asleep during the day. I was driving and working a route business at some point, and I would have to pull over to take a nap.
Number one, sleepiness is never normal. Sleepiness is always a problem. People tend to think about the teenager who falls asleep in school as that they're lazy or they're bored. But the other thing that I want to call out that he just stated is that I'm so glad that he took the safety route, which is that a lot of people try to power through feeling sleepy while driving. Sleepy driving is the reaction time equivalent and the same legal risk as driving under the influence of alcohol.
Sure is.
And the only two things that actually will mitigate that risk is strategic napping, pulling over like Eric just described, or strategic caffeine, utilizing some sort of stimulant in order to mitigate that. And that's temporary. But if you are having consistent sleepy driving, that is your call to action to be checked out.
Are you finding that sleep physicians are prescribing Adderall for people who are having that daytime sleepiness? And is that normal?
Again, excessive daytime sleepiness is never normal. It is a treatable condition. But the first thing to do before prescribing anyone any medication is understanding what is the cause of sleepiness, right? And so my area of expertise is in central disorders of hypersomnolence. So those are your brain makes you more tired than other people because there's a biological difference. And so when we look at those conditions, there is kind of the first class kind of drugs you use, alerting agents, which are medications that have a similarity to your stimulants like Adderall, Ritalin, but they're specifically formulated to enhance the wakefulness of the brain with less systemic side effects.
What are some of the names of those?
So I would say that some of the names that we will prescribe are things like modafinil or Provigil, armodafinil, Nuvigil, solriamfetol, Sunosi, pitolisant, Wakix, and those drugs are to kind of help with the wakefulness. Alternatively, you can use oxybate medications, things like Xyrem, Xywav, and now the once nightly Lumryz. And then our second and third line therapies are your traditional stimulants. Now, the challenge is that we can see sleepiness not just because of these conditions. It can be the leading cause of sleepiness in the United States is insufficient sleep syndrome. So meaning that we are getting less sleep than what we're supposed to. If you look at the census data of what is the average amount of sleep that an adult gets, and in 1960s, it was 8.5 hours a night. Now it is less than 7 hours. It's about 6.8 hours a night. And so when you look at those statistics that the average adult is not even getting close to what is appropriate, of course, we're a nation of sleepy people. Giving them a drug to wake them up is not fixing the problem.
I agree.
It is just putting a Band-Aid over it. It's just covering my eyes. The same thing is true when we look at other conditions like obstructive sleep apnea. Excessive daytime sleepiness can be there despite appropriate treatment of that.
They want everything fixed with a pill nowadays.
Yes.
And it's like, it's easier to take a pill than it is to sacrifice a few hours to actually go to bed earlier because it's the fear of missing out.
They still need to have a sleep study. They need to make sure that they're going, whether it be a home sleep testing or an in-lab study, that they definitely need to get it diagnosed versus a physician that would just prescribe something.
The average listener who's going, hey, I can identify with this. I am a sleepy person, and that's problematic to me, is that an overnight sleep study does not diagnose sleepiness problems, right? So things like narcolepsy, idiopathic hypersomnia, those types of conditions, it's an overnight in-lab sleep test with a following day MSLT. And the second piece to that is if I have a person who's sleepy and they're AHI, so the number of times an hour that they're saying that we're having a respiratory event, if it's 5 to 15, that is not the cause of your sleepiness.
That's right.
And most labs have adopted that if I have someone who has AHI of 15 or less, that I should still go on to that next day test, a multiple sleep latency test. And so the reason I say that this is an important call to action for people who are sitting there going, I'm sleepy, someone ordered me that home sleep test, it was normal, or I got a diagnosis of obstructive sleep apnea and it was AHI of 12, and I'm still sleepy, it's because you've gotten the wrong test. You've been shortchanged. The average person who has narcolepsy or idiopathic hypersomnia, the data that we have currently is demonstrating anywhere between a 3 to 18 times increased likelihood compared to other people in the United States of also having sleep apnea. So that's why it's important.
I just feel like if there's any kind of indication there and you are having daytime sleep, go in lab. There's nothing better, because there's this myth that it's so barbaric and you're not sleeping in your own bed and it's all. But guys, it's just like anything. I hate MRIs, but it's helping me, right? And I think with the awareness of sleep nowadays and the billions of dollars that's invested into sleep, we've talked about athletes, all this. You just saying that means the world to me, because an HST is just not enough sometimes. Home sleep testing,
and they totally play a role. So if you would have,
I agree.
If you would have talked to me a few years ago, especially pre-COVID, I would have said no one should have a home sleep test. It's really an insurance's way of just getting away with a cheaper process, and that we're not adequately or accurately identifying people. However, what I do think is that when we see healthcare islands, meaning that we're in areas of the country or the world where there's not access to a lab, that it may help us in the process, but we need to always be thinking again about whether or not we need further imaging or not imaging, further testing in order to better.
So that's my pivot here. Whenever Anne's at home and you go, "How was your day?" Is this what she taught? Like, does she go into?
Oh yeah,
I love this. I love this.
It's kind of hard to keep up with,
because you might be a damn near expert by now.
Oh, let me tell you.
I'm being serious.
Oh no, this is.
I'm
should be serious,
okay.
because you know the number of times where I come from another room and he's on the phone and I hear him being like, "Well, you know what you should be doing in order to put your child to sleep," or it's like, and it can go in either perspective, from a neurology side or a sleep side. And I have to tell you, he's on point.
Well, yeah.
Remember the time we were out somewhere and I'm like, that guy has club digits, and you're like, oh yeah, like there's.
Explain to our audience.
So club digits. It almost looks like a person has like a rounded end to it, and that is because of the fact that there's generally a pulmonary or cardiac issue, and so what happens is that. Because your digits, this part of your fingers, it's the farthest from your heart. Your body's really smart and tries to create more blood vessels to get oxygen there. And so by default, they then become bulbous.
100%.
And so that's the reason why they're called club digits.
Yep.
What's amazing, though, is that her knowledge isn't only neurology and sleep medicine. It's so, like, she has such a grasp on all aspects of healthcare that it's mind-blowing. And there's people that will call for advice on all kinds of issues. In fact, two people. One was a colleague of hers. She saved his life by telling him over the phone, "You need to go to the ER.
Now
something's being missed," and he would have been dead had it not been for her.
He had a pulmonary embolism.
Yep. Another one was my friend Arafat. His father was had some broken bones in his neck, and it's like they're missing something. Oh, he went to Sloan. They didn't miss anything.
Yeah. And I was like, he has multiple myeloma.
Yeah, definitely. And he ended up going back, and of course, during their neck surgery, I think they found that he had cancer.
Wow.
Yeah. So I mean, she can pretty much tell anything, any part of healthcare. I mean, she's just great. Patient advocacy and all, like heart, cardiovascular, everything. I mean, she just has knowledge on every aspect of it.
So when you become a mother, your perspective of your wife, did you see that change? Like, and how did that manifest itself? Did it
from day one? Literally from day one. So we had a hard time having children initially, and we thought we weren't going to be able to have children, and we've obviously been blessed with two beautiful, healthy children. And so when I was pregnant with Reagan, our daughter, from day one, it was like, she's drama since she was conceived, I swear. And so during that pregnancy, it was a challenging pregnancy with a lot of different things, all the way down to the end where they had me coming in for weekly biophysical profiles to check on the health of the baby because a certain measurement wasn't right. And so I was just a nervous Nelly the whole time. And then when she was delivered,
worst case scenario, that's where her mind goes to always.
Especially for the kids, because I never want to miss it, right? I don't ever want to be like, oh, it can't be my child because I'm a doctor, type of thing. And so when my daughter was delivered, just as every mother, when they deliver their baby, they give you the baby right to you because we want to do skin to skin. And so they gave me the baby, and I took Reagan, and I go, take her away from me. She has respiratory distress. And I go, no, you're fine. You're just a new mom. I go, no, she's nasal flaring. She's retracting. She's having difficulty breathing. Take her away from me. Wow. And so they take her away. and they put a pulse ox on her. They called the NICU team. She's satting like 80-something%. I haven't heard her have a strong cry, and I'm yelling at him, squeeze her toes, because I want
Like,
her.
I know what to
want
do.
her to
I know,
cry,
yeah.
and so that's how we generally will squeeze on their toes to make them cry. And he's like, and he just looks like he's pale now. He doesn't know what to do. He's freaking out, and then they go, we have to take her to the baby ICU, the NICU, and I just sat there crying, and he's going, what do you think is wrong? And he's right. My head went to all the worst case scenarios. I go, she has a congenital heart defect that they missed. She's septic. She's gonna die. Like, and you just think worst case scenario. And thankfully,
2 days later, we were home.
Yeah.
So you go home after 2 days.
Yeah.
You probably became a different. Obviously, you're a mom now, but a different physician after. Now you have two healthy
100%.
children, because now you have what we call empathy. But I love working with physicians who have children.
Yeah. Well, we just had another reminder, which I think also made Ann even a better doctor, with Reagan being in the hospital for about 3 weeks.
I wasn't going to mention that. But that's why I said recently.
Yeah. So
I know that was kind of like.
Yeah. And me, of course, I know enough to be dangerous, right? So when the doctors are talking, I can keep up with most of it, but I still don't understand the definitions of 100% of everything they're talking about. So her hearing how the physicians are talking to her, she doesn't even want to be spoken to like a physician. Then she wants to be spoken to like a mom. I love that. And I think it was a wake-up call for her.
This is my child.
Yeah, that parents that are in the ICU or in the hospital with their child, they need to be spoken to at a certain level that's relatable. It's really confusing and scary time for parents, even for us.
Yeah.
So new parents, they don't sleep.
Yeah. What
advice could y'all give? Because y'all still have young kids. By the way, mine graduated high school.
Zippered onesies, no buttons. Because when you're delusional at night and you're sleep deprived.
What about your kids? I'm just kidding.
You're trying to change that kid and you're trying to deal with buttons and everything.
Yeah.
Oh my God. We were like, this is just a nightmare.
Yes.
And then those little milk bottles, even for the breast milk, make sure you screw those caps on properly, because you're so tired, and then you go over and you think you're feeding the baby and you're just dumping out all this breast milk all
and
over
that,
the place.
as a breastfeeding mom, you're like crying.
You're so tired.
It's like liquid gold.
Yeah. It's a challenge. It's really tough. I don't care what profession you're in.
I agree.
I think you're going to have the same level of sleep deprivation. When you have a newborn.
Yeah. And so I think for Eric, I the same, was a breastfeeding mom. And so I was really the one who did the majority of the nights, because although it was exhausting, it was also that special time for me and my child, right? And so we really didn't do bottles overnight. But
when Ann's not home and she's traveling and everything, he is a little angel with me. Once she's home, I can't do anything for him.
Yeah.
He's like, mommy gets me ready for bed. Mommy brushes my teeth. I'm like, okay, whatever.
Yeah.
But Reagan and I we have our little bond there, and definitely there were more bottle feedings with Reagan.
I think accountability is awesome, even in marriage, and that means support. You take that role very serious, and I just meaning you briefly. You take it serious, and I love that.
Eric and I, our relationship and our roles have kind of evolved over time, especially based on when we lived in New Jersey versus moving to Pennsylvania. One of the things I'll call out is that even though Eric works from home, he's working. He's not only working running his business, but he also is working keeping up the farm and everything else.
So you called it a farm. Got her.
And so he literally is the jack of all trades, right?
Yeah.
And so one of the things, and it's funny because people that we meet who know me first and then meet him, they're always more interested in him, because they're like, you're like the Dos Equis guy. You're the most interesting man in the world, because he has just stories that whether it's from the time when he was in PJ training in the military and jumping out of planes versus when he had his biohazard remediation company and crime scene cleanup, and he's doing jobs for the FDA, or he's doing like an unattended death or whatever it might be. There are things that other people have never experienced or heard of, and then he comes across as this very unassuming guy, right? And so for me,
I met him and he took his shirt off right away. I mean, he was laying out by the pool, but no, unassuming you're talking about.
But one of the things that I think brings so much value to our family, and even though our positions are a little bit different, is that it gives our kids metrics of success that are equal success.
Absolutely.
Different tracks.
100%.
Right. And so I always love the fact that Eric is like, I tried college. It wasn't for me. And I love to tell that even to my patients.
Absolutely.
Of that my husband, equal success to me. He didn't take the straight and narrow path like everyone is conditioned to think is the only opportunity, right? And the reason I highlight that is we had on Juliana Rankins, right?
Yes,
and she told us such a great story. She finished her 4 years at A&M, was pre-law, going into law school, right? Because that's the straight and narrow we're all trained to do. We have to do all these things in order to check boxes to be socially accepted, to be successful, right? She now is a rising star in country music, and I can't wait to see her name up in lights, being a tremendous success. What I can say is that I've had the privilege of being able to see the same thing for my husband, of that he did not follow the same straight and narrow that I did, right?
And even in my industry, I mean, at my degree, I didn't have to have what I have to do what I'm doing. So I 100% agree with that. And even in my daughter's choice she finally made a decision to go to college, but she wasn't. She was going to go to beauty school. She really wanted to start working. And I think that you're right. How we grew up, it was different. It's like, you're going to school.
And then talking about support, it's not just me supporting Ann and what she does, because when Hurricane Sandy hit, for example, I just owned my pest control company, and I was looking, we were in an area that should have been flooded, but wasn't, but all around us was.
I think y'all might have been the only area.
I mean, we were right in Secaucus there.
Yep.
So, I mean, it was strange. There were people behind us, and I'm watching the news. I'm like, I can't believe the amount of suffering right around here. So I took about 6 months off of work, and I started just with me and a couple of friends going and buying, truckloads of stuff from Home Depot and driving to like Breezy Point and all these different areas in Jersey and in New York, delivering needed items. Because we found the Red Cross really wasn't doing it. I mean, you had to find the Red Cross. They weren't coming to you. So,
and these are families who are stranded where they're at.
Yeah.
So they're able to drive to.
You're talking about Louisiana.
Yeah.
Yeah.
I know, and even in Texas. So
So it was 6 months of gutting houses, providing respirators for crews that, people went in there, they're ripping out asbestos they didn't know, but I knew. And then that led me to believe that there was something more I want to do, because the pest control business, although, I did well financially with it, it wasn't something I had a passion for. And I know how passionate she was about her field. And I'm like, that's missing in life. So talking about crazy, you think it's weird that I support her saying I want to do a podcast. Imagine your spouse coming home and saying, I want to open up a crime scene cleaning company.
Yeah.
And she was like, go for it.
Yeah.
So, I found a school. I got certified in that and environmental disinfection, which dealt with disease outbreaks and pandemics. And then I went through a ton of FEMA training, OSHA training, became an OSHA instructor. And that was, again, putting me back in a point that was before kids, where it was very disruptive sleep schedule. I mean, I could get a call at 7 p.m. on a Friday in Brooklyn and have to drive in 3 hours of traffic to get there and work all night long. And then you could get another call on the way back. So that was,
following your passion.
Yeah.
Right.
Yeah.
I think that it's funny, the stages of life that we've even talked about during this podcast, having children, meeting when y'all were so young, even 10 years ago, meeting and then making the decision, finding that right person. I think kind of a common theme, and you tell me if I'm wrong, Ann, because you usually do. You usually do tell me when I'm wrong. Is that it's there's something about going with your gut, from meeting each other to dart on your chest, going, oh, something's wrong. You having an instinct to take this leap and follow kind of your heart. I just feel like that's what life is. And too many people, you said it, they don't have a passion. And by the time they realize they don't have something they're passionate about, it's something like a spouse or a friend, hopefully a podcast that goes, man, if you could do you have this passion in your life for whatever? It doesn't have to be getting paid for. It could be service. It could be whatever. But are you doing something that you're passionate about? I think a lot of us don't have a passion. In America. I don't know about anywhere else, but they just don't have a passion. They do the 8 to 5. They're raising their kids. They're doing a good job, but there isn't something that's out there that they follow.
Well, I think that what you're describing now is a natural consequence of the downward spiral. Like, so even when I am giving the descriptions of these are statistics around sleep, and these are in the 1960s compared to now, the way that I always tie things into sleep is the fact that a great night's sleep starts with the time that you open your eyes in the morning, right? And so when you open your eyes and you start your day and you construct your day, and it is just to the wall, like filled with things that make you feel good, and you've put out good energy, that is going to drive you to the point of being able to then fall asleep easier. There are clear studies that have demonstrated the bidirectional link between the stress that you experience in a day and how your time management is with what your quality of sleep is. The more stress, the poorer your time management, the worse your sleep. The worse your sleep is, the more that unravels. So what you're describing to me is the fact that many people in our country, when we look at the characteristics that are most important for success, it's not your IQ. It's not how smart you are. Right. It is your emotional intelligence. It is your emotional quotient. And the first foundational component of your emotional quotient is self-awareness. When you don't know who you are, what makes you tick, what drives you, why you respond with an emotion to things in one way versus another, whether that's good or bad, you now lost the control of navigating forward. Agreed. And therefore, you will never identify what your passion is because you don't even know what makes you happy or what makes you sad. You can't name it. And so what I would say is that if you're listening to this and you feel like, I feel like I don't have a passion. I don't know which way to go. I don't know what I should be studying in college, what career. I'm stuck in this dead-end job. I have kids and I feel like I'm just checking boxes all day. Take a step for yourself, whether it's 10 minutes a day, to really reflect on self-awareness. Who am I? What makes me tick? What are the things? How do I respond to positive experiences? How do I respond to negative experiences? Start naming those. That allows you to really direct yourself in a way that's going to be more meaningful. And I know that it sounds trite, but I guarantee you it also will help you in terms of making your best days as well as your best night's sleep.
I think that's how we should end it. You're amazing. Eric, you're amazing too, brother.
Thank you.
Thank you so much for sleeping around with Dr. Ann. You do every night and nothing. Thank you guys. Really appreciate it.
Thank you.